As a dentist, I've seen many people suffer from a dry socket after a tooth extraction, and it's usually because of one simple mistake people make. But the good news is you can significantly reduce the chances of getting a dry socket, and there's ways to minimize that. And in this video, I'm going to show you exactly what you can do to try and minimize the risk and how to treat it if you already have it. Now, most people don't think about a dry socket after an extraction until it happens. And when it does, it can be a very painful experience. And knowing how to prevent it can actually make all the difference. So what is a dry socket? Now, what happens is after an extraction, your body forms a clot over the exposed area or the exposed socket. And think of it as a natural bandage. So what happens is if that clot, which is supposed to be protecting your bone and the nerves underneath, gets dislodged or dissolves too soon, that can actually affect the healing process. And when that happens, the socket is left exposed, and that leads to the painful condition that we know as dry socket or alveolar osteitis. Now, unlike normal post-extraction soreness, which gradually improves over the days, dry socket usually starts from day 1 to day 3 post-extraction or post-procedure, and that can significantly get worse. And the pain can radiate to your jaw, to your ear, the side of your face, making everyday activities difficult and uncomfortable. So things like eating, talking, and unlike regular post-surgery pain, which is usually managed with over-the-counter painkillers, dry socket is much more intense and harder to control. So why does a dry socket happen? Now, the exact cause isn't fully understood, but research suggests it could be linked with inflammation or poor blood clot stability. While it can technically happen to anyone after an extraction, there are some factors that can make it much more likely. So, for example, drinking with a straw after an extraction, poor oral hygiene, smoking, and sometimes even hormonal changes, for example, from the use of oral contraceptives. And studies show that dry socket occurs in 1% to 5% of routine extractions, and can go up to 38% in lower wisdom teeth extractions. So the real problem with dry socket isn't actually just the pain, it's the delay in the healing process. And instead of new gum tissue forming smoothly over the socket, the area becomes exposed, and that increases the risk of infection because food particles would then end up trapping inside, and that creates an inflammatory reaction, which can make the pain worse. And if you notice things like a bad taste, a foul breath, or even visible bone in the socket, those are signs that you might actually be having a dry socket. But before we get into how to prevent it, let's clear up some myths about dry socket that some people believe, which simply aren't true. And the first myth is antibiotics prevent a dry socket. Dry socket isn't an infection, it's a healing issue, and antibiotics won't stop that from happening. And the second myth is only wisdom teeth cause a dry socket, and this isn't true, because even normal routine extractions can cause a dry socket, especially when the clot is dissolved or lost too soon. And actually understanding what doesn't work is just as important as knowing what does. So we also need to know how to minimize the risk of developing the dry socket. So how do we minimize the risks of developing a dry socket? Now, the good news is dry socket doesn't just happen randomly. There are certain things that can make it far more likely, which I mentioned earlier. And most people who actually get a dry socket accidentally develop a dry socket without actually even realizing it in the first place. One of the biggest risk factors is anything that disturbs the blood clot, especially in the first few days after the extraction. And the first common mistake is using a straw. Now, what happens is when you use a straw, you physically pull the clot out of place, leaving the socket exposed. Another major reason is smoking or vaping. So not only does the actual suction motion break the clot or can make it dissolve too soon, what happens is the nicotine in the cigarettes actually reduces blood flow to the gums, and that makes it harder for your body to heal. So smokers are actually twice as likely to develop dry socket compared to non-smokers. But even if you don't smoke or don't use a straw, you can actually still increase your risk of developing a dry socket, especially when you rinse or you spit too aggressively. A lot of people make the mistake of using a mouthwash or rinsing their mouth, and they force spit or spit too hard. And what happens is that sudden pressure change can actually dislodge the clot. And finally, poor oral hygiene can actually also be a problem, because what happens is the bacteria builds up around the extraction site, and that can make it break down prematurely and can actually dissolve the clot too soon, which can then increase the risk of dry socket. And that's why following your dentist's aftercare instructions and advice is very important and crucial. But now, even if you've developed a dry socket, it's never too late. There are ways you can try and manage the pain and speed up the healing process. So what to do if you already have a dry socket? Now, if you're dealing with a dry socket, you probably know how painful it can be. And the good news is there are ways you can try and manage the pain and you can speed up the healing. And the first thing is don't ignore the pain. So unlike normal post-extraction discomfort, dry socket pain doesn't gradually improve. It actually gets worse. It's been more than 3 days since your extraction and the pain is becoming more intense than fading. it's a clear sign, or it's highly likely that you have a dry socket. The second thing is avoid home remedies that don't work. So a lot of people I've seen make the mistake of aggressively rinsing with mouthwash or using essential oils or applying some home remedies like clove oil directly into the socket. While these can provide some temporary relief, it can actually make the problem worse. The best advice I suggest you follow is gently rinse your mouth with warm salt water or use a dentist's recommended mouth rinse, but never swish too hard. So just make sure you bathe the area with warm salt water. Use over-the-counter painkillers, for example, ibuprofen, that can help. But if the pain keeps getting worse, then I suggest seeing a dentist, because what we do is we'll clean up the area, we'll flush the area, remove any debris, and we can apply a medicated dressing that can provide instant relief. And in most cases, the pain would settle in a few days after it's been cleaned and treated. But the key is catching it early. So if your pain gets gradually worse, then I don't suggest you wait. If you found this video helpful, I've got another video about post-operative care after an extraction. It will help you recover faster and can help you avoid mistakes people make after an extraction.